Welcome back to the deep dive. Today, we're tackling something really important, a set of chronic conditions that often, well, they leave people feeling totally confused, dismissed even, like maybe they're just too complicated for doctors to figure out. So our goal today is simple. Give you a kind of shortcut to understanding this chronic illness trifecta. We want to explore why they often show up together and why knowing that is so vital for, getting a handle on your health.
Absolutely. And what we're talking about here are POTS, that's Postural Orthostatic Tachycardia Syndrome, EDS, which stands for Ehlers-Danlos Syndromes, and MCAS, or Mast Cell Activation Syndrome. Now, I know those names sound pretty intimidating, but really they're just labels, ways to describe how your body is struggling. The crucial part, and this is fascinating, is that they don't just randomly appear. They often cluster together. It creates this complex picture.
Yeah, that interconnectedness is really the core of it, isn't it? So maybe let's just quickly break down each one for context. POTS, that's basically your autonomic nervous system. The body's automatic controls going a bit haywire, right? Leads to dizziness, that racing heart feeling, serious fatigue, especially when you stand up.
Exactly. Then you've got EDS. That's a group of conditions affecting connective tissue. Think of it like the glue holding your body together is, well, faulty. Too stretchy.
Right, so that shows up as like hypermobile joints, maybe chronic pain, skin that bruises easily.
Precisely. And the third piece is MCS. This involves your immune system's mast cells being overly sensitive. They react massively to things that should be harmless. So you get allergy-like symptoms, flushing, stomach issues, all sorts of reactions.
Okay, so those are the three. But how do they actually link up? How does one affect the others?
Great question. I sometimes use an analogy, like picturing your body as a house. With EDS, think of it like the house has weak foundations and maybe shaky beams at your connective tissue. Then POTS is like faulty wiring and plumbing your autonomic nervous system. And part of that dysfunction comes because the foundations, the EDS, are unstable. It affects everything.
Ah, I see. So the weak structure makes the internal systems unreliable.
You got it. And MCAS.
Yeah.
That's like having a super twitchy security system. Your mast cells going off constantly, even when there's no burglar. And here's the kicker. They don't just sit side by side. They actively make each other worse. It's a cycle.
How so? Give us an example.
Okay, well, think about EDS making blood vessels too stretchy. That structural weakness can directly worsen POTS symptoms when you stand up. Then you have MCAS, where activated mast cells release chemicals. These chemicals cause inflammation and make blood vessels dilate, which, boom, makes POTS symptoms even worse.
Wow.
And that chronic inflammation from MCAS, it can significantly ramp up the pain somebody experiences with their EDS. It all feeds back.
That makes so much sense. And it explains why the journey to get diagnosed is often, well, a nightmare, a real maze. I bet you've heard stories, maybe experienced it yourself, just struggling to get doctors to believe you.
Oh, absolutely.
Hearing things like, oh, it's just anxiety, or, well, your basic tests are normal, so you must be fine. It's incredibly invalidating.
It really is. And it's so important for you listening to hear this. Your experience is valid. POTS and MCS physically mimic anxiety symptoms. That racing heart, the feeling of panic, it feels identical, but the trigger is physiological. It's not all in your head.
That's such a crucial point.
The reality is our medical system often isn't set up very well for these kinds of complex multi-system conditions. It's very siloed. So the shift needs to be less about wishing the system were different and more about what you can actually control. You really have to become the CEO of your own healthcare journey.
Exactly. Be proactive. Because that typical approach, seeing specialist after specialist, and maybe they don't even talk to each other, it often just doesn't work, does it?
It often fails, yeah.
You might even get conflicting advice, right? Like, high salt intake is often recommended for POTS, but what if that triggers your MCAS? It gets complicated.
That's precisely why an integrated approach is key. We need to look at the whole picture. Many experts now talk about a kind of hierarchy of treatment. Often, the first step, the foundation, is stabilizing MCAS.
Why MCAS first?
Because those overactive mast cells create so much widespread inflammation that inflammation can worsen POTS symptoms and increase EDS pain. So by calming the mast cells, you often see improvements across the board. Less inflammation can mean less POTS flare-ups, less EDS pain, just a calmer system overall.
That makes sense. Address the biggest fire first, maybe.
Sort of, yeah. And alongside that, something absolutely vital is learning to pace yourself. Avoiding that boom and bust cycle, the push-crash thing, is critical. Pushing too hard just flares everything up again.
Right. So wrapping this up then, understanding these connections between POTS, EDS, and MCAS is, it's more than just interesting information. It's fundamental. It helps you understand the diagnostic hurdles, why things feel so complex, and why you really need to take charge with an integrated view. You're the manager.
Absolutely. And here's a thought I want to leave you with. You really can't afford to just wait for the medical system to perfectly understand all this. It's catching up, but slowly. And you certainly can't let dismissive comments define how you approach your own health. So the real question is, what's one small thing, one step you can take, maybe even today, to shift from feeling like just a patient reacting to things to being the active CEO of your own well-being? What does that first step look like for you?